the moonlight. It's an experience. Then 6 is red increased, like the sunset. Again, I am the sunset. I'm not looking at it. Then the 7th stage is black near attainment. Everything is totally black. Again, I am the blackness. I'm not looking at the blackness, the darkness. And then the 8th stage is called luminosity. Luminosity. And again, I'm not looking at a light bulb or the sun. I am the luminosity. That's the experience. When that's finished, then that very subtle mind and energy residing at the heart chakra leaves the crown, or maybe the lower orifices. At that time, from a Buddhist perspective, the person has died. And that's when the body starts to go through the changes of corpse. Rigor mortis sets in, stiff. The freshness leaves. There can be black and blue and blisters and corpse stuff, okay, happening within hours or a day or so, depending on temperature and environment. Now, the internal visions that the person experiences for the 8 stages are like a mirage, water in a mirage. Stage number 1. Number 2 is like billowing smoke coming out of a smokestack. Like smoke. The 3rd stage are like fireflies. Do you have fireflies in Hong Kong? Fireflies in the dark night, darting around. And the 4th stage is like a flickering flame. A candle about to go out. That's the experience, inner experience. 4th stage. And then 5 through 8 I've described. Whiteness, redness, blackness, and that kind of luminosity, clarity, extreme clarity. Now, there's some interesting research going on in India, conducted by the University of Wisconsin, Madison, Dr. Richard Davidson, who's done a lot of the work with long-term meditators and studying their brains, and I was a subject, as Professor Chen mentioned, for some of that research. He and his team are now doing research on people that seem to not die. We would go visit them, no heartbeat, no pulse, no blood pressure, no breathing. We say the person's dead. But no rigor mortis, flexible. Okay? Body's fresh, doesn't look like a corpse. And we're not talking about refrigeration, no AC. Okay? And there's sometimes even a smell of very subtle hint of perfume or flowers. If you're around that person and you do some meditation, it's like you just have this feeling of going very deep in your meditation. You feel very joyous, just actually being around. This is not a normal, this person is not dead. You can feel it. And when we stop, this is called tukdam. Tukdam is a Tibetan term. Means tuk is the mind. It's an honorific term for mind. And dam means sacred, so it's sacred mind. It's this 8th stage, this clear light or luminosity, they say. And they can stay in this for weeks. 1 week, 2 weeks, 3 weeks, 4 weeks. We've observed this. The scientists have observed this. Now they're trying to examine and trying to figure out what it is. And in the next few years, you'll see it more and more in the literature. So a couple things are happening. One is they're beginning to question whether or not there can be a mind, a subtle mind, that's independent of the brain. Remember, the person has already died, according to modern Western medicine, allopathic medicine. Should be a flatline EEG, no heartbeat, no breathing. Okay? And yet, they're very fresh for sometimes a month. What they're doing is they're staying in meditation. Okay? So the scientists are trying to discover, see what this is all about. So this will, in the next few years, you'll see it. It'll open up the discussion, what actually is death? when does it occur? This will be opened up again in the medical field. We'll see this. And the other question it's raising is about subtle consciousness. It might be something that's independent of the brain. Thank you for your question. Yes, please.
You talk about self-cultivation and self-discovery. So I was just wondering if you didn't go to you became a Buddhist monk. So if you went the conventional way of becoming a family doctor, did you think you would have reached your kind of level of enlightenment? Or I just feel like sometimes it's for people who practice religious asceticism, or they kind of like go on retreats and stuff. It's kind of easier to maybe kind of cultivate yourself. But say sometimes if you live in the real world and you have to, like, real life kind of gets in the way sometimes. Do you think it's harder to get wisdom and all that kind of stuff?
Thank you. Wonderful question. I think the answer is yes. The answer is yes. But to just live in a cave all of our lives, in a way, is rather selfish. Now, it is important to do the self-discovery, to try to change our habits of so-called destructive emotions, reduce our anger, reduce our jealousy, reduce our pride, reduce our self-doubt. It's important to work on those things. But at the same time, it's important to be engaged in the world with our love and compassion. Whatever we do well, we're doctors, or about to be doctors, in a few years we'll be doctors, but we might be artists, we might be dancers, we might be gardeners, we might be all kinds of things. When we do our activities in our daily life, when we interact with people, to do it with honesty, do it with respect, develop trust, and love and compassion. So to blend these two, I think, is the best. I'm nowhere near enlightenment. I'm just an ordinary person like you. I've got lots of troubles myself, okay? Of course, much less than I had 20, 30, 40 years ago. But still, I've got lots of stuff that I deal with. Of course, I'm human. That's part of being human. Okay? But I take this journey seriously of self-discovery. I take it seriously. And I spend at least 3 or 4 hours a day working on that, formally. And then hopefully a few minutes here and there during the day also. But it can be done. One does not have to be monastic. One does not have to retreat to the cave in order to work on our negative emotions. Okay. If we think that way, I'm sorry, but it's a cop-out. Use that expression in Hong Kong? Yeah. It's kind of, it's kind of avoiding the issue. It's kind of avoiding the issue. It's our responsibility as human beings, and our responsibility especially as budding doctors, to work on ourselves, to become better human beings, okay? So we can do a better job with our patients, with ourselves, with our families, our colleagues, our friends, our neighbors, etc. Thank you for that question. Yes. Please, this gentleman and then this gentleman. Please.
Do you have any advice for when you have to deliver bad news to patients?
Yeah, great question. Did y'all hear that? Bad news. Yeah.